You're juggling it all: work, family, decisions, expectations, 6 hats, maybe more every single day. But behind the scenes, your body is running on stress, and stress left unchecked will lead to illness. I'm Dr. Shami, an integrated family doctor, and this is 6 Hats, the podcast that helps you understand what stress is doing to your body and what you can do about it now. Hello, everyone. Welcome back to the 6 Hats podcast. Now, today, we're going to talk about ADHD, and ADHD is often talked about as a behavioral condition, something to manage with focused strategies or medication alone. But what if we looked deeper? Today, I'm joined by Dr. Ali Ajaz, a psychiatrist and brain health specialist based in London, UK. Now, Dr. Ajaz trained in forensic psychiatry within the NHS, holds an academic role at Queen Mary University, London, and now runs a dedicated brain health clinic focused on nutritional psychiatry, gut brain health, and functional medicine. So in this episode, we explore ADHD through a holistic lens, looking at the role of nutrients, gut health, sleep, lifestyle, and nervous system regulation. Welcome, Ali.
Hi, Shami. It's a pleasure to be here.
Amazing. And like what I said offline, it is so rare to find psychiatrists like yourself. So thank you for doing what you're doing. And so it kind of goes on to my first question. Why are you so unique? Like, why aren't we seeing so many other psychiatrists thinking about nutrition?
Very kind of you to give that amazing introduction. I don't personally feel unique, but I think I know what you mean around looking at other psychiatrists and the role psychiatry plays in medicine as a whole. It reflects the training and I think the conditioning and the programming of doctors, that it's the role of doctors to recognize symptoms, put them into a working diagnosis, and then be able to prescribe a drug or a surgical procedure for that. And that's very much our training. Whether we like it or not, that's the top and tail of it. Now, that can be helpful on a surface level for a lot of people, but in the Western world, we're seeing rates of all health problems, not just mental health disorders, increasing and increasing. And I think it reflects the failure of our medical systems not to really help address the underlying issues that are driving these. So you can put a plaster on it, but it'll kind of wilt away, it'll get wet, it'll fall off, and it'll need reapplying. And you can only do that so much when it comes to the human body before things start to deteriorate further and further. So most of our colleagues, I think, find it difficult to break out of that paradigm, especially when you've attached your livelihood and your financial commitments to your family, to your house, mortgage, to all the regular stuff that regular people have. When you try and tease that away, because at some point there has to be a bit of a personal reckoning and a bit of a personal risk, and making things uncomfortable before you can go down a slightly different route. And I think that's unfortunately too much for a lot of people, whether it's personal circumstances or financial commitments or things like that. So I think that's really the paradigm that we're coming out of. And I don't know why some doctors come out of it and others don't. We were talking about this before. I think it's a personal epiphany that happens. You don't necessarily make a choice to say, I'm going to do this. But once you're aware that there's a different way of doing things, you can't really close your eyes and go to sleep and carry on doing the same thing day in, day out once you have this awareness.
Absolutely. And you know what? It's so interesting you say that, because I say this so many times to patients who come in and I explain down the integrative pathway. And I often say, the training is what's the drug as a solution rather than what's the root cause. And I actually say nutrition, nutrients completely missed out of medical school training, that the level that we need to know. And it's so vital. Because I've been practicing it for so many years, I can't even think of going back. And when you think about it, wow, magnesium is needed for over 600 chemical reactions in the body. And we're just not even aware of it, how important key nutrients are. I was listening to this great analogy, actually. Your car, if there's something wrong with it, there's a light popping up. And an easy fix is like, oh, let's just remove the cable so the light doesn't pop up. And that's literally sounds so dumb that we're just going to do that. We need to find that root cause. But literally, this is how we're treating medicine now. Oh, you've got a headache. Let me give you an aspirin. But hold on, Could this be magnesium deficiency? Could this be hormonal changes? So when I listen to that, I go, oh my God, this is what people need to hear, that the current medical model is very much surface level rather than looking at the root cause. And what I love about what you're doing in the ADHD and psychiatry field is looking at that, because to be honest with you, when I do refer to psychiatrists, even in Australia, it is all about medication. And especially with ADHD, they literally come out with a script within 15 minutes, which just blows my mind.
Yeah, it is embarrassing now as a professional doctor of 20 plus years, looking back at how we were taught and how we were practicing for, I would say, most of my medical career. It's embarrassing. It's like we've been gaslit in a very overwhelming way that, of course, nutrients are important, because nutrients are needed for every cell in your body to function at all, let alone optimally. And all the cells get together to form tissue, that get together to form organs. So whether you're dealing with a brain, whether you're dealing with a gut, heart, liver, on a root level, are the cells of these organs getting the nutrients they need to function well and to make energy? And crucially, when it comes to the brain, it weighs roughly 2% of your dry body mass and has about 20% energy consumption. So when there's low nutrients, low energy, your brain's going to feel it more. And how's that going to translate? There's no pain receptors in the brain, but we have things like cognition, executive functioning, we have mood, we have anxiety, psychosis, all these things, what we consider now as mental health disorders, mental health conditions that psychiatrists diagnose. And if we're not aware of this one simple, basic premise, which is there in the neurobiology, it's not a novel idea, but we've been gaslit in our training that it's been overlooked. And it's embarrassing now to admit that.
Absolutely. And we're going to go more into ADHD, but it just kind of reminded me, like when patients used to come, my days in the NHS, it was like 6-minute, 10-minute appointments. They used to come and they would feel depressed or anxious. And we were so quick to prescribe an antidepressant or anti-anxiety. And I didn't even ask about sleep. I didn't even ask about nutrition. And like you, I just feel so embarrassed that actually happened. But let's move on to ADHD, which I'm really excited to talk about because your approach is different, Ali. And I'd love for you to get an overview of your holistic approach to ADHD.
So thank you. Yeah, so I would say it's not a novel approach in the sense it's really looking at brain health from a global perspective. And when you do that, you can actually help whatever issue someone is coming in with. So whether we call that ADHD, whether we call that depression, whether we call that cognitive decline. And it's really looking at trying to support the brain on several levels. So the first level is physiologically, and a big part of that is nutrients, but also toxins, things that are disrupting the brain function. But is the brain getting what it needs physiologically? Is it able to clear out what it needs to get rid of, the junk, the waste, the toxins that it needs to get rid of in order to work optimally? So that's a physiological aspect of brain health. And then we've got the psychological aspect. So we are the product of everything that came before us in our lives, the way we think, the way we feel. And sometimes, often we internalize negativity in our lives. And especially if you're neurodiverse, if you've got ADHD, if you're an adult and it's been undiagnosed for many years, you've probably had, at the very least, a personal awareness that you're different to people, or you're not as good as people, or you have to work harder in order to achieve the same as your peers and your colleagues. But invariably, you've also been told that by parents, by teachers, by bosses, and you internalize all this negativity, and that manifests as negative self-talk, those negative features that we have day to day in our day-to-day lives. And I would argue that it's not a natural way to have a negative thought about yourself. If we want to survive, if we want to pass on our genes, if we want to be productive members of our society and community, negative thoughts aren't helpful for that, aren't conducive for that. I think any negative thought anyone has is something that you've internalized from either someone or something negative that's happened. So it's about understanding the mind works and to challenge and, again, clear out negativity and to allow the natural state, which is kind of optimism about the future, what we have as children, or children are generally optimistic and curious about the world. It's only when we internalize negative things that happen that we lose that. So once you clear out the negativity, then it does create more space for that natural curiosity and excitement and positivity to come out again. So that's the second part of brain health, the psychological, how the mind works. And the third part is looking at your social networks. And we thrive in communities. And what we're seeing now is that more individualized emphasis on society. So whether you're a single person or whether you're a single unit, a partnership and children, but you're in your unit rather than being in a community. Social aspect is really important part of how well your brain thrives. And finally, we have the bigger questions. And I think it's in this order that thinking about life, thinking about our purpose, why we're here. And it's not about coming to a specific answer, but it's coming to some recognition about what we're doing here. And I think that's really important. But that can only really happen once the other aspects of brain health have been addressed. And I think that really helps mitigate people against what we see as a midlife crisis. And it's different reasons why that can happen. But once you're more comfortable about why we're here and what we're doing here, and whatever answer you arrive to, that's a really great protective factor into our older age. So it's really that paradigm of four aspects of brain health.
Yeah, I love what you said about that purpose and meaning, and also the loneliness. And it's really interesting because we screen for loneliness in our intake form, and people can be in relationships in big families but still feel lonely. What do you say to that? I know we're sidetracking here.
No, not at all. I think that's really key. If people are more susceptible to the loneliness aspect if they haven't developed a core sense of their self. They're not comfortable with themselves, looking for external validation. We're looking from a partner that gives them reassurance, or siblings or parents that give them that reassurance now in older adulthood. Invariably, that comes as a result of not having this unconditional love from a parent, not to be from both parents, but from a parent in your formative years. And they're called formative years because it helps shape and form who you are and who you will become. And if you have a safe, secure parent that can give you a real grounding for your own self-esteem and self-confidence, then you can thrive individually or in communities. But if you're not given that, then that's where the loneliness becomes a big issue, because you're not getting any external validation or external support for your own self-esteem. Now, it's not, as you mentioned, not about just being with people. It's about the nature and the quality of those relationships.
Wow, that's a really interesting perspective, because I'm already thinking it's so right, because it depends on your perception of loneliness as well, and what your needs are. So true. But I'm going to dive it back to ADHD, and I love to focus on your key nutrients. And I love your Instagram posts. I think listeners, you should follow Dr. Ali Ajaz on Instagram. They're awesome posts, and that's where I found you. But yeah, what are your key nutrients when it comes to ADHD?
So my story about how I got into nutrients and ADHD in particular is all thanks to the algorithm. So we all have negative voices around YouTube algorithms, online algorithms. But I was sitting there one day, and on my feed came a talk from Julia Ruckledge about nutrients and mental illness, and she's a New Zealand researcher, and it just blew my mind. So it's a short 10-minute TED talk, and it just outlined the importance of nutrients, nutrient deficiencies, but also adding in nutrients in trying to help overcome mental disorders. And it blew my mind because, as we said from the outset, we're not taught any of this when it comes to medical school or medical training. And at this point, I've been a consultant forensic psychiatrist for many years, dealing with complex mental health cases, but I never came across this. And there and then I ordered her book, The Better Brain, and I read it within a couple of days, which is unusual for me. And that blew my mind further. So from that point, I was convinced, looking at the research and having an academic and research background myself, that was really helpful in order to give me the confidence to just try and offer these as an option, additional option to the people that I work with, my patients. And in essence, it's a multivitamin, a particular formulation that they were using. And I managed to source that in the UK. It was only one place that was offering it at the time. And I started to see amazing differences in people who are able to be consistent with the micronutrients. So micronutrients are essentially a multivitamin. You've got your vitamins, range of vitamins and minerals. And people were able to take them for 8 to 10 weeks. I started to see consistently that mood was improving, anxiety reducing, sleep improving, focus, attention. I've had some people who didn't want to go down the medication route when it came to ADHD and started taking the nutrients. And there was this one chap, I remember he was an aspiring musician, and I didn't hear back from him for a few months, and which is not unusual. Some people keep in contact, other people don't. But then after month 5 or 6, he messaged me saying how the nutrients had changed his life and how he could just apply himself and overcome a lot of the core difficulties that the ADHD brain had put in the way about being organized, about managing his emotions. And it really reinforced to me at that earlier stage just how powerful the micronutrients are. And they have minimal or no side effects. Nutrients, we eat food because food gives us nutrients, and we put nutrients in capsules to try and help. One of the key messages that high dose nutrients is important. So it's not only getting the right combination, but the right amount. And I think that's where a lot of nutritional supplements probably fall short, that people aren't getting enough of the nutrients in order to make a significant difference. But because this was grounded in the research, it gave me that confidence. And I've never really looked back.
Wow. Oh, I actually recall Julia Routledge's study, but I'd love to break it down. So what were the key nutrients? What is it actually made up of?
So there's lots of individual research looking at, say, magnesium deficiency and ADHD symptoms, zinc deficiency and ADHD symptoms. There's research by itself looking at 30 milligrams of zinc, adding that to stimulant medication to help improve symptoms of ADHD. There's iron studies around iron and focus, and iron is very important when it comes to dopamine synthesis, the role of copper, selenium, whole range of micronutrients. So there's individual nutrients, and looking at not only just ADHD, but mental health disorders more generally, that vitamin D is also very important. So from the research, using a multivitamin makes a lot more sense, because the research shows if you've got ADHD, you're more likely not just to be 1 or 2 or 3, but more like 4 or 5 nutrient deficient. So it makes a lot of sense. It also makes a lot of sense because nutrients work in teams and pairs. And if you give, for example, high levels of magnesium, and the impact of that on vitamin D is inverse. So high magnesium affects vitamin D in a negative way. High vitamin D affects magnesium in a negative way. It's a two-way teamwork that happens. So I think as doctors, we still have this it's like reductionist approach where we think we have to be microscopic around, well, if you increase a bit of this, then that will help overall function, but not realizing the impact of that on others. So nutrients work in teams, and it makes a lot more sense to me that to give a multivitamin rather than individual nutrients, because sometimes we can cause unintended negative impact. And I've done that myself as well, taking high doses of vitamin D without taking magnesium and then getting leg cramps, thinking, oh gosh, what's going on here? But then kind of dawned on me that, I should be taking a bit more magnesium if I'm increasing my vitamin D intake.
That's so interesting. So when a patient comes to see you and they may or may not have had a diagnosis of ADHD, but they're looking for some guidance, what would you say your top 3 nutrients, or is it the combination? Is it this multi that you go for?
So the malt is there as a staple, and I think everyone should be on a multivitamin as a daily brain investment. So I take the same on myself, 4 capsules every day. If you've got ADHD, you should be taking untreated ADHD. It's closer to 12 a day, but it is a dose of brain investment we all need. We've all got brains. We all need to look after our brains. But the multivitamin is number 1 when it comes to ADHD. Number 2 is high dose omega-3 fatty acids, so DHA and EPA. And these are really so essential for the brain. The hard mass of the brain is made, in the most part, with these omega-3 fatty acids. So we need a constant supply of these just to help the brain just to function regularly, let alone improve in terms of overcoming some of these deficiencies. And omega-3s are anti-inflammatory. They help with neuroplasticity. They help with nerve function, nerve growth. It's just so important. So that's always my second. And the third, it varies, because you have to be careful about how many supplements you
Yeah.
you start someone on, especially if they're not used to taking any. So it can vary depending on the person. If they've got lots of gut issues, then it might be a probiotic that I add in, and there's evidence to support a higher dose. Again, high dose is a common theme of probiotics. So we're looking at over 100 billion CFU per day to help with ADHD symptoms directly. And there's some research I've seen to support that. Other people, I might recommend some amino acids. So looking at the precursors for a neurotransmitter synthesis. So we've got the precursors, and then we've got the nutrients, which effectively work as cofactors. So we've got enzymes that are catalysts for chemical reactions, but there's enzymes, at least a quarter of the enzymes that exist, and there's thousands and thousands, require cofactors. So these vitamins and minerals in order to function. So if we're giving the precursors and we're giving the cofactors, we're really trying to nudge the brain to make more dopamine, which in most people with ADHD, that's a big issue, that either your dopamine demands are too much, or invariably the brain is not making enough dopamine. So it's about naturally trying to support the brain to do what it needs to, where there's a clear deficit. And we're not sure where the bottleneck is, but in nutrients and cofactors, as cofactors and precursors, is, I think, a good and safe start.
Amazing. I do want to ask about the multi, because I think it's really important. There's so many multis out there. Which one would you recommend? Is it Julia Ruckledge's one that you?
Yes. So for me, my thinking was, well, if this is what was shown in the research, then I have to get exactly the same thing. And so the multivitamin is made by a team called Hardy's Nutritionals, and they're a Canadian company which have been going for about 30 years. So they're very well established, and I've met some of them personally from the team. They make their supplement in America, and they do ship worldwide. I work in relationship with them, and I supply those to the UK under the Brain Wealth brand, and that's something that I've set up. That's quite a cool thing to do. But I'd much rather someone else be supplying them, having a business in the UK, selling those particular supplements, or Europe or worldwide, because I don't really have time to box up supplements and ship them out. But I'm happy to do it until someone fills the void.
Amazing. Let's move on to lifestyle, because I think we underestimate, and I want to touch upon screen time, and I want to touch upon sleep. What are your thoughts around our screen usage, and how does it impact brain health?
Well, if we're looking in part at why we're getting more ADHD, more attentional focus issues, screen time is a big component. And there is research out there to show that increased usage of screen time increases the risk of ADHD, or at the very least attentional issues, which is a core part of ADHD. Anyone who struggles with attention these days, will worry about whether I've got ADHD or not. And again, if we take a step back and we think about it, as a child growing up, if you're accustomed to a screen and everything that comes with that, the quick movement in scenes, the colors, the sounds, it's very intoxicating. It absolutely affects brain development and the thresholds for attention when it comes to day-to-day life. If you're used to things that are rapidly moving versus things that are pretty much constant. When I was a child, look, we didn't really have screens, and you just had the world around you, which doesn't change. Your bedroom doesn't change, your garden doesn't change, your classroom doesn't change. But now we replace this with screens. And even if you go to gardens, if you go to restaurants, places that are more stimulating but relatively static, you've got kids there with phones, everywhere. Parents are giving kids phones so they can focus on eating by being distracted. And that is extremely damaging when it comes to being able to regulate yourself and regulate your own attention in particular. ADHD is not an attention deficit per se. The name is a bit of a misnomer. It's not being able to allocate attention when you need to and want to. So often the more mundane aspects of life you struggle to focus on because they're just not stimulating enough, because that's not what you're used to. You have a greater need for a stronger stimuli in order for you to get stuff done. So that's why often things can be left to the last minute. And then it's that fear. And the fear is a stimuli, the fear of punishment, the fear of being told off, the fear of getting a bad mark in your assignment will push you. And often that's why all-nighters are quite a a regular report for people with ADHD that they need some stimuli, some threat, some risk in order to get things done. And that is highly stressful. It's not adaptive. It will affect your sleep. And again, it will reinforce some of these negative things. Like, why can't I just work like my friend who just did the assignment 2 weeks ago, or did it slowly over the course of the semester? What is it? What's wrong with me? So these factors are really important when it comes to why we're getting more issues related to ADHD than not. So it's both of them, the nutrients. We know that not only is food less nutritious as it was 30 years ago, people's eating habits are less helpful. So we're getting more and increasing nutritional deficiencies. There was a national survey in the UK from a couple of years ago, and that was comparing the trends over the last 10, 15 years. And it's all going in the negative, in the wrong. People are more nutrient deficient than they were, and that's only going to get worse. And then when you add in the impact of screens on neurodevelopment, it is a bit of a recipe for disaster. It's not a surprise that we're getting more attentional ADHD adults.
So much sense. I loved how you mentioned kids in restaurants and everyone's on their phone. I actually went on holiday, I think it was a year ago, and we were in this resort. I could not believe it. At breakfast, every single member of the family around me was on their phone. And I was just like looking around going, what has the world come to? No one's connecting. Yeah. Everyone is, distracted and in their own world. There is definitely going to be a reason why there are mental health problems, just even looking at that kind of behavior. But I want to move on to sleep. And I'd love to hear about your patient stories because I know patient sufferers from ADHD have problems getting to sleep and having this routine, and they often stay up till 1 or 2 in the morning. What's your advice around that?
It's a very common issue. And often people with ADHD go to sleep through exhaustion. So they kind of have to either tire themselves out in the day or by watching something, and that just gradually kind of wears them down, and then they kind of fall asleep. A big issue is that the nervous system is dysregulated, and where most of us over the course of the day, especially towards the evening, are able to calm, people with ADHD aren't. So they're still having racing thoughts. They're still thinking about yesterday, today, tomorrow, all at once. And that just doesn't settle in the evening when you would naturally expect it to. So that they end up having bad habits at night, sleeping late, eating late. And it's just very, very harmful, and it reinforces the problems that they're experiencing when it comes to executive functioning. So understanding a big part of why people struggle to sleep, we can try and help put in strategies. And that's really the way I like to frame it, is having strategies. So there's not just one thing that's going to help everyone, but it's about having a handful of things that are going to be working for you and your particular set of circumstances. So we talked about nutrients and nutrient deficiencies. So magnesium, for example, magnesium deficiencies can increase people's anxiety. If you add in magnesium, it can help people calm, especially at night. So that's something that can be really helpful. But there's also that physiological calming of the nervous system. So guided meditation, deep breathing, exercise in the day, in particular, first thing in the morning, funnily enough, helps with better sleep in the evening. But I'd say exercise any time of the day is very key to help establish a good sleep routine. So helping regulate the nervous system better through some of these strategies, trying to sleep at a regular time and waking up at the same time every day to try and develop a pattern. All these things are key. Having a dark room, not being disturbed, not sleeping with your phone. If you struggle to sleep, don't lie in bed, because you start to associate sleep problems with your bed. Get up, walk around, do something, and then come back. And don't just lie around in bed or be on your phone, because these are just really bad habits that are not conducive to sleep. When you go into bed, there's only be one thing really that you should do in bed, is sleep, not anything else. So, it's about shifting the mindset and really empowering people. It's, you don't have a disease, you don't have a disorder, you just don't have good enough habits. And adding those habits, then you can change. You can change your experience of the world around you. You can change the brain you have. You can change the way you use your brain. And ultimately, I feel that the way we practice is essentially empowering people. Most people don't need a doctor. I'm sorry, doctors. Most people don't need you.
Yeah.
If they get the right message around just how to put in good habits, because what we've been talking about is essentially we've been learning bad habits from a young age, and then it just gets worse. It just escalates if we don't get the right education. And unfortunately, doctors aren't the people to give the right education because of the training that we've got. That actually, it doesn't matter about how you live your life, or we give lip service to, oh yes, you have to eat well and sleep well and do some exercise, as they kind of sit there with their full sugar Coke and image.
And McDonald's.
Yeah. And it's lip service, but it's not more important than your medication. And that's very disempowering, that people feel, well, I can only function while taking a pill. And what worse thing is there in life than that, if the pill helps at all? And so I think the reason why our message resonates so much is about empowering people. I don't want to keep seeing people forever. Work for a couple of months. And I know what will help. I know what will help people's brains heal, improve, help them live the life that they want. It's whether they're able to put those things into practice, and whether we can work together to find where the first starting point is, and then what phase 2, phase 3, phase 4 is. But the further we go along, the more someone is doing, the more they're able to progress and need me less. If I'm working with someone at end of year 1, 2, 3, 4, I've failed, really. It shouldn't be that difficult.
I love that. I love it. We do resonate in how we practice, Ali. That's amazing. Now, before we let you go, where can listeners find you?
So I have the social media handles at Dr Ali Ajaz on Instagram and TikTok, and I have a website, draliajaz.co.uk, where people can book in or send me a message.
Amazing. Thank you so much for your time today.
You're welcome. It's been an absolute pleasure.
Thanks for listening to Six Hats, where it's all about progress, not perfection. If this episode spoke to you, don't wait, hit follow now, leave a quick review, and share it with someone who needs to hear it. Want to take your next step today? Download my ebook. The link is waiting in the show notes. And remember, this is general advice only. Always speak to your practitioner for anything medical. See you next time.